Welcome back, guys. Now in this video, let's discuss about some important respiratory reflexes. Okay, already we have discussed cardiac reflexes. Guys, are you able to remember Cushing reflex? Increase in intracranial pressure decreases the heart rate. We have discussed about the Bainbridge reflex. What is Bainbridge reflex? Increase in the venous return to the heart. Right atrial distension increases the heart rate. Bainbridge reflex. And 𝐒𝐳𝐼𝐻 reflex, certain cardiac irritants like serotonin, veratridine, capsaicin are going to decrease the heart rate with hypotension and apnea. So those are the cardiac reflexes already we have seen. Also in central nervous system we have seen certain reflexes. Now here in the respiratory physiology, let's see some important reflexes for your exam. Now I am asking you, okay, I am asking you, take inspiration. Try to do it. See, I have asked you to take inspiration. Again try to do it. Who is asking you to stop? You have stopped it or not? At certain point of time, have you stopped it or not? Yes, you have stopped your inspiration. Okay, even though I have asked you to take continuously, you have stopped it at a point. Okay, again try to do one more time. Stopped. Okay. See, there is someone, or I should say there is someone who is trying to prevent the hyperinflation of lung. Okay, otherwise if there is hyperinflation of lung, there is a chance that your alveolus will rupture, your lung will rupture, sir. Okay, it's not good. So when you have sufficient amount of air into your lungs, tidal volume, and even though if you try to take extra tidal volume, once your tidal volume is reaching 3 times, there is enough air in your lungs, further inflation can lead to damage. So someone have to, or some reflex have to prevent the hyperinflation of lung. So that we will discuss now. Okay. See what is happening. See, whenever there is inflation of lung, okay, whenever there is inflation of lung, that's going to cause the stretch of the lung. That's going to cause the stretch in the lungs. So that stretch is detected by the stretch receptors in your lungs. So in your lungs, what are there? Stretch receptors are there. So whenever there is lung is getting hyperinflated, or whenever your lung is getting inflated, lung is getting stretched, the stretch receptors are activated. So these stretch receptors are attached with which sensory nerve? Vagus. So now this vagus nerve is activated. Okay, the vagus nerve is activated. So from your lungs, this vagus nerve is taking this information to your brain that there is inflation of lung, this information, sensory information is going. Now what is this vagus nerve going to do? So this vagus nerve, first of all, where is it going? It is going to the apneustic center. Vagus nerve goes to the apneustic center and inhibits the apneustic center. So now you tell me, once the apneustic center is inhibited, you know, apneustic center is the one which tries to prolong the inspiration. So whenever your apneustic center is inhibited means your inspiration is inhibited. So this reflex is preventing the hyperinflation of the lungs. So this is called as Hering-Breuer inflation reflex. Hering-Breuer inflation reflex. Okay. So what exactly is a Hering-Breuer inflation reflex? Hering-Breuer inflation reflex will try to prevent the hyperinflation of lung. Hering-Breuer inflation reflex, which receptors are activated? Stretch receptors are activated. Which cranial nerve is activated? Vagus nerve is activated. Which centers are inhibited? Apneustic center is inhibited. Okay. So this is your Hering-Breuer inflation reflex. Important for the exam. Next. See, in Hering-Breuer inflation reflex, what is happening? Tell me. Whenever there is inflation, respiration is stopped. There is inhibition of respiration. So this is something normal. Inflation stops inspiration. Inflation of lungs stops inspiration. Okay, this is something normal. But only once in your life. Okay. Once in your life, the inflation of your lungs will further promote the inflation or further stimulates the inflation. When? Do you know when? During your first breath. You tell me, in your, in a child who is in the mother's uterus, what is the status of the lungs? The lungs are in collapsed state. So after the birth, you have to completely open the lungs. So when you inflate for the first time, to completely open the lung, to completely open the alveolus, you have to take more and more air so that your complete lung should expand. Okay, so this is something unusual, right? What is Hering-Breuer inflation reflex is telling you? Inflation should stop inspiration. But here, inflation is further promoting the lung inflation. Okay, inflation is further promoting the lung stretch. So that's why this is called as a paradoxical reflex. So this is called as Head's paradoxical reflex. Okay, Head's paradoxical reflex. So tell me, Head's paradoxical reflex is seen in newborn. Okay, it's seen in newborn child first breath. Next, one more reflex is there, that is called as J reflex. So what exactly this J reflexor? J stands for what? J stands for juxtapulmonary receptors. Okay, juxtapulmonary receptors. What are these juxtapulmonary receptors? What they will do, I will tell you. See, these J receptors or this J reflex is detected by the Indian physiologist from the AIIMS. His name is A.S. Paintal. Okay, he discovered these J receptors. Now, these are your pulmonary capillaries. Okay, these are your pulmonary capillaries. Now, surrounding your pulmonary capillaries, juxta means side to the pulmonary capillaries, there are these receptors present which are called as J receptors. Okay, here are the J receptors. Now, what do these receptors detect? Receptor means it should definitely detect something. They detect the congestion within the pulmonary capillary. Okay, they detect congestion in the pulmonary capillaries. So, you tell me, whenever there is congestion, okay, the blood flow is very slow. You tell me, whenever there is pulmonary congestion, what should happen to the blood going to the lungs? Already there is congestion. If more and more blood goes there, that can translate, this congestion can translate into edema. So, immediately whenever there is congestion here in the pulmonary blood vessels, these J receptors are activated. These J receptors are going to activate the vagus nerve. Okay, these J receptors activate the vagus nerve. This vagus nerve takes this information. The vagus nerve takes this information to the brain that there is a pulmonary congestion going on. So, immediately your central nervous system understands that there is pulmonary congestion. Immediately your central nervous system is going to decrease the heart rate. Okay, it decreases the heart rate. So that now less blood will go, because already congestion is there. If more blood goes there, you know what happens. That can lead to edema. So, immediately in a person who is having congestion, due to the activation of these J receptors, the heart rate decreases and BP decreases. So, let me explain the same thing here. Here I have already written these things for you. Whenever there is pulmonary congestion, that activates the J receptors. J receptors activate the vagus. Vagus takes this information to the central nervous system. Immediately the person is going to have bradycardia, hypotension, and even apnea will be seen. And other changes will also be seen, like there is weakness in the skeletal muscles, but that's not what I am more concerned about. Here in your exam they will ask you, all of the following are seen in J reflex except. So, you should know the person who is having the activation of the J receptors in pulmonary congestion conditions, the person is going to have bradycardia, hypotension. Bradycardia, hypotension, and even apnea can be seen. That is called as your J reflex. J stands for juxtapulmonary receptors. What is the importance of this reflex? Prevents edema or pulmonary edema. Okay. So, with this, the important three reflexes are completed. Hering-Breuer inflation reflex prevents the hyperinflation. Head's paradoxical reflex will help in the inflation of the lungs, complete opening of the lungs, and J reflex is going to prevent the pulmonary edema. Okay. So, with this, the important reflexes in the respiratory physiology are completed. Hope the video is helpful. Thank you.